Compared to the wealthiest and most developed countries in the world, the US spends the highest amount on healthcare, but ranks last or almost last in all major categories like infant mortality, life expectancy, heart and lung disease rates, and teen pregnancies. In other words, we pay the most and get the least. Our healthcare is so expensive that 25% of senior citizens end up declaring bankruptcy because they can't afford their medical expenses. Statistically speaking, that means that 1 out of your 4 grandparents will go bankrupt trying to stay alive in this country. Researchers estimate that if the US healthcare system performed as well as the systems in Australia, Japan, or France, we would have 100,000 fewer deaths in the US every year. Now, we could compare countries all day, but I want to focus on the most damaging part of the system, which is the way that insurance companies operate. Because medical insurance is a for-profit industry, insurance companies are going to do everything in their power to avoid paying for your healthcare. Their main motivation is higher profits, not your well-being. Now, what's interesting is that rejecting claims is kind of a clumsy way to increase profits. The easiest way for insurers to increase profits is to simply not insure the people who need insurance the most. Other countries have already solved this problem in really interesting ways. In Switzerland, for example, insurance companies have to redirect any profits they make towards reducing premiums for their customers. In Germany, health insurance companies are nonprofit organizations to begin with, and if they happen to turn a profit, the money has to get rolled over and applied towards providing services for the next year. In many European countries, for-profit insurance companies make money not from covering basic care, but by upselling customers on supplemental coverage like eyeglasses, dental care, and luxurious hospital arrangements. The bottom line is that in the US, for-profit healthcare incentivizes less care. It bankrupts people who need care the most, and it puts the US at the bottom of the pack compared to every other industrialized nation. So what can you do? It's obviously a complicated problem and there's no perfect solution. But currently the only major proposal that addresses the main flaws in this system is Bernie Sanders' Medicare-For-All plan, which would have 3 major consequences. Number 1, it would reduce administrative costs, which will immediately make healthcare less expensive. 2, it would reduce the role of for-profit health insurance in our system, which means no more bankruptcy filings for your grandma or GoFundMe campaigns for your sick nephew. And 3rd, it would guarantee healthcare as a right to all Americans, which means more healthy and productive citizens contributing to our economy. If we're going to continue to spend the most, then let's actually make our system the best that it can be. Peace.